Hello, my name is J. Michael Bennett. I am a board-certified orthopedic surgeon who specializes in sports medicine, primarily arthroscopic and minimally invasive surgery of the shoulder, elbow, and knee. Today we're going to talk a little bit about stress fractures, and there have been a lot of buzz going around the most famous stress fracture, which occurred approximately 1 week ago with Kevin Ware with the Louisville Cardinals. He sustained what we call an open fracture of the tibia, also known as a compound fracture. There are a number of different ways you can have a fracture of the tibia, but when it does break the skin, it's considered a compound fracture, which is a very serious injury. There are ways to minimize or prevent these type of injuries from happening. The key with these type of injuries is to identify it early and to make sure that you see your orthopedic surgeon and you come up with a plan to prevent abnormal stresses across the tibia, particularly when you're doing a repetitive active sport like running or basketball, where you have a repetitive activity performed over and over and over again. And what happens is that you have these loading stresses across the tibia that are just overloading the bone's ability to basically heal itself. So these repetitive stresses are basically building up, and the bone is trying to heal quickly enough, and sometimes it overloads that ability to heal, and then you get what's called a stress fracture. So this is basically a very crude drawing of the tibia and fibula bone. The tibia is right here. This is also known as the shin bone here, and then the fibula is over here, and this is the outside bone that helps support the tibia in the lower leg. This is the front view, and then this is the side view. These are usually the two views that we will get on x-ray when we're evaluating a patient for a tibial stress syndrome, or also known as shin splints, or if we're concerned about a stress fracture. Typically, the area that we're concerned about is this distal 1/3 of the tibia. And what will typically happen in a patient with stress issues across the tibia is that you'll get an inflammation of the lining of the bone, okay? And the bone has this lining called periosteum. And that lining of the bone can become easily inflamed by these repetitive stresses. You're not going to see anything on an x-ray. This is going to be something that you will feel and describe to your doctor. And a lot of times you'll see a little bit of swelling in this area and have some point tenderness in that area on your physical exam. The key is to make sure you treat it appropriately to prevent it from getting worse. If this periosteal, this periostitis does not go away or does not get better, you definitely want to see a doctor to get an x-ray, because what we look for on an x-ray is when you have a repetitive stress that has not been treated or diagnosed and has not been allowed to heal, you can get evidence of a stress fracture. Now sometimes on an x-ray we'll see a little bit of abnormality across the bone, like a little bump like that across the bone, where the bone's trying to heal and it's trying to build up to heal across those stresses. But occasionally on the x-ray we'll see a little black line there, okay? We call that the dreaded black line. We get an x-ray of that and we see this area. This is indication of you having a stress fracture. On both views you'll typically see this abnormality. So you'll see a little lump here with that little black line across that area. So what happens is if you do not treat this appropriately early on, that little black line can propagate and eventually can split across and go all the way across that tibia. And what will happen if you go out and you play and you do not treat this accordingly is you will develop a fracture at the distal third of the tibia and you will have a broken bone, okay? Now, so it is key that you do be evaluated by an orthopedic surgeon just to make sure that, number one, you get the correct diagnosis and you get treated early. And number two, you have somebody repetitively following you to make sure that this is healed completely before you're allowed to return to full sports and activities. Now, what causes this problem? This is a very common problem in regards to the periostitis, but it's less common to see the stress fractures. However, we are still seeing this in a certain demographic of patients, and it seems to be a little bit younger than it used to be. And it may have to do with the increased year-long sports and activities, and also the fact that these just aren't being diagnosed early enough. Now, what causes it? Well, there's a couple things. Number one, it could be a structural issue, meaning that those stresses across the tibia are occurring because there is an abnormal amount of stress occurring in that distal third due to an abnormal stress pattern across the tibia because of a structural issue. What can happen, or what some patients have, everybody's different in regards to their leg shape and their foot shape. But what makes a big difference is the shape of the arch of your foot. Okay, you basically could have a couple different types of arches here, and these are just three here that I'm just drawing primarily. This is just a side view of a foot. I know it looks a little abnormal, I apologize for it. But this is when a person's weight bearing on the ground, and this is a high arched patient. Okay, if they're weight bearing and they stand up and you got a good arch there, that means you do not have a collapsible arch, you do not have flat feet, but you do have a high arch. Okay, this is kind of this is called a neutral arch here, and this is where the arch collapses when you stand up. The whole arch collapses down here. What that does, if you look at a person when they're standing upward, it overloads the lower leg. Okay, this is basically just somebody's foot here turning outward, but this is showing you the collapsed arch portion here of their foot here, and it increases the stress across the lower leg. These are just this is a very crude drawing here, but just basically to understand that the arch collapsing is something to take seriously. And that's when you want to consider something like an orthotic. Now, another way to diagnose a collapsed arch or a flat foot, aside from just looking at your feet when you're weight bearing, is to look at the bottom of your shoe. If you look at the bottom of your shoe, and if there's a certain wear pattern of the bottom of the shoe, if it's more worn on the outside of the shoe than on the inside of the shoe, that means you're running on the outside of your foot, you're probably more likely to have a high arch here. So it might be a good idea to try to look into maybe getting an orthotic to kind of help balance out your foot when you're running. If you have more wearing on the inside of your shoe, then that means that you may have a flexible flat foot or a flat foot that's wearing out the inside of your shoe. And these are the patients that definitely you need to consider some sort of orthotic to give you that medial support for the arch to help recreate and give you a little bit more of a stable arch when you're running, because you do not want to overload the bones and tendons along the inside of the foot. Now, that is a structural issue. That is an imbalance across the stresses across the knee and the leg, and that's something to evaluate and have your orthopedic surgeon evaluate. Now, that's one possible cause of the stress fractures. Now, number two could be a metabolic or an endocrine issue, which could be secondary to a couple of things. Number one, calcium levels. Number two, vitamin D levels. And number three, possibility of parathyroid issues. These three help bone heal and help normalize your levels in regards to healing potential within the bone itself. If you have an early black line here, a stress fracture, it's important that your physician talk to you about what causes that stress fracture. They may diagnose it and they say you have a stress fracture, but you need to stay off of it for a period of time, and then when you get better. Well, the problem is that you still don't know why you got it. It could be the way that your arches are in your foot. It could be the way that you're running. It could be the fact that you have some low calcium, low vitamin D, or issues with your parathyroid. These are all things that need to be worked up and evaluated, because if you don't treat the underlying cause for the stress fracture, you're going to continue having problems and you're going to continue going back for another treatment. Typically with these fractures, if you catch them early enough, it can be a very easy treatment of using a protected weight bearing, as well as modification of your activities, and using a special boot that allows you to stabilize this area and allow it to heal. Sometimes even a bone stimulator can be used, where it's a device that you put on the outside of this fracture that helps increase your healing capacity, and you wear that a couple times a day to increase your healing of this fracture site. So it is very key that you make the diagnosis early, that you be evaluated by an orthopedic surgeon, and that you find out what is the cause of your stress fracture so it does not propagate and become a full fracture. So that being said, that really is the basics behind this. There's a lot more detail regarding stress fractures. If you do have this problem, I suggest being evaluated by an orthopedic surgeon or sports medicine specialist. That being said, if you do happen to have a fracture that does break, the treatment for that fracture is an intramedullary rod, which you actually put a rod down the shaft of the tibia. This is the front view, this is the side view here, to actually bring those bone fragments together to allow them to heal. And that's a very standard procedure that we do plenty of in orthopedics, but the key is to prevent it from getting to that point. So like I mentioned before, if you're having these symptoms that just aren't resolving, I suggest you go be evaluated by your orthopedic surgeon and maybe get some x-rays and an evaluation, and make sure you get a diagnosis early so you can prevent these problems from getting worse in the future. If you have any questions or comments, please feel free to visit my website at jmichaelbennett.com or www.orthopedicsportsdoctor.com, or feel free to call my office at 281-633-8600. Thank you very much.